Having the best possible outcomes when it comes to COPD often involves the E word elixir. Now, yes, I really would be better served maybe to use the word medication, but the word elixir is probably important to use as well. Now, when it comes to pharmacology, an elixir is this mixture maybe with water and alcohol and other substances in to produce a medicinal outcome. And some people think about an elixir as the be-all and end-all. And so that's what I want to land on just for a little bit here in this video. I want to make sure that you understand that medications alone are not the key. There is no magic pill for you to take. There isn't a substance to inhale, a medication to inhale that will make everything all better. It takes more than just medication. So when you think about your elixir, you want to make sure that you are taking it and taking them as prescribed by your physician. And if you have a question, make sure you ask your pharmacist when you go to get the medication as prescription fulfilled. Prescription filled. Make sure you ask. So you have the questions. We talked about education in another video. But make sure you understand what it can do, what it can't do. When are you supposed to use it? Some people might use their short acting when they're supposed to be using their long acting, and or they may be using supposed to be using their corticosteroid instead of their mist, or whatever it happens to be. So make sure you are using your medications well. So remember, there's 3 questions I want you to ask when you consider each of these E words. So, what am I doing well? You might say, I understand when I'm supposed to take my medication. And you might say, then the next question I want you to ask is, how can I do better? Or what do I need to do to improve in my use of the medication to have my best possible outcome with my disease? So you might say, wow, I might need to have it with me always, or I might need a different solution in terms of my oxygen therapy because this one isn't maybe working as well. Maybe it's a little bulky, so how can I figure out what to do there? And then the third question I always want you to ask is, what system do I need to put in place? How could I, to help me improve in these areas that I want to improve in? Or might I actually even need to improve in? So those are the 3 questions to ask. When it comes to your elixir or your medication, be sure that you're taking them as prescribed, that you understand when to take it, and that you don't skip doses, and you don't wait if something seems to be coming on, an exacerbation seems to be coming on or something. You make sure you take your medication as prescribed. That way, you know that you can breathe better and live better.